we are here to actually provide all the support to develop students to become a confident graduate that is needed by the industry. Please feel welcome to visit us to see how we do our transformation of students.
Hello, everyone. Good evening. Thank you for joining us and taking your time on Friday, or should I say on weekend night, to understand more on the very important topic today. That is the least spoken of many, especially in our country and society, which is on psychotherapy. Right. So we will actually unpack more on what is psychotherapy is about and some of the myths surrounding psychotherapy that we have in our society through this talk. So hopefully you can get some insight. But first of all, let me introduce. I will be your today moderator. I am Ko Chin Kat here, the head of the department for American degree program at SEGi College Penang. Today, I have with my colleague, Miss Grace Tan Jia-Yun, who is also a psychology lecturer with the American degree program under SEGi College Penang and also a child psychologist. With her working experience on working with children, so we will be discussing on what is psychotherapy about, the importance of psychotherapy, and why psychotherapy might be the least preferred options in our society when it comes to the mental health and well-being. Firstly, I'd like to pass on to Grace to uncover and share with us on what are the psychotherapy is all about. Grace, over to you.
Okay, thank you, Mr. Carl, and very good evening to everyone. Thank you for having you all with us, okay, in today's talk. So before we talk about the myth of psychotherapy in Malaysia, okay, I would like to give you some introductions or insight on what is psychotherapy. I believe that the term psychotherapy, right, is not very new terms to everyone. Okay, even if you didn't heard the term psychotherapy before, perhaps you might heard the terms counseling. Okay, so especially during this pandemic, okay, more and more counseling services, okay, are provided by our government, and our governments, especially our MOH, is also encourage, okay, for those who are feeling stressed, who are feeling depressed, okay, go and see a counselor, okay, so that it will help out. So do you really know what is psychotherapy or what is counseling? Okay, I would say that actually counseling is part of psychotherapy, and in the proper definitions for psychotherapy, right, actually psychotherapy is a way for us to treat mental health problems, okay, by talking to psychiatrists, psychologists, or other mental health providers such as counselor, such as therapies. So what is the difference between these three? Psychiatrist, psychologist, counselor, therapy. Are there a difference between these three? Yes. Okay, I will go for I will explain to you by one. I will go for psychiatrist first. Actually, for psychiatrists, right, they are a medical doctor who are specialized in preventing, diagnosing, and treating mental health. So they able to prescribe medications, okay, for their patients, okay, such as antidepressants, okay, and so forth and so on. As for psychologists, their job scope, I would say that is pretty similar to psychiatrists. Okay, they are the one who expert in studying the mind and the behavior of their clients. Okay, and they are great in evaluating and treating both mental and emotional disorders such as depressions, anxiety, PTSD, post-traumatic syndrome disorder. So, what's the difference between psychologists and psychiatrists? Actually, the main difference here will be for psychiatrists, they're able to prescribe medications to their clients or to their patients. As for, however, we will use a lot different way, different methods, to help, to discover our clients or our patients' problems, and we will find a way to help them to overcome it. Okay. Last but not least will be counselor. Okay, counselor is pretty common in our society, I would say that. So as for counselor, they will work with their clients, to identify their goals, their aspirations, and their potential, and also come up with variable solutions to the problems that they face, which will cause them have distress in their emotions. Okay, so they are great in growing communications, coping, self-esteem, and promoting positive behavior. So these are the differences between these three professions. So all these three, while they are using psychotherapy, right? Okay, they will use psychotherapy to help their clients, to treat them or to help them. So mainly psychotherapy will be used to help the clients in order for them to learn about their emotions or their feelings, especially those who are unconscious. So for example, clients might come to the counselor saying that I'm stressed, or I get angry easily, but I'm not sure why. So in counseling, we will start to dig, or we will start to discover, explore your inner problems, the problems that you hide inside unconsciously, and we will help you to understand what emotions you are experiencing now. What is this? What will cause this? Okay, so it first of all, it experience. Next, they also will be used to help their clients to know more about their thoughts. Okay, what are they actually think about it? Why would they have these thoughts? For example, why would some individuals or some people they will have negative image about themselves? Why would they have low self-confidence? Okay, all this is because of their thinking, of their thoughts. Last but not least will be their behavior. We will study about the behavior, understand why would they behave in certain way, why they unable to control their emotions, why they unable to control their impulse. Okay, so we can see that all these 3 points actually they are interconnected, they are linked. Okay, how we think will affect how we feel, and indirectly it also will influence our behavior. So this is why psychotherapy will focus on these 3 elements, and from there we will help our clients to learn more about themselves, to overcome their problems or their issues. As for psychotherapy, people will ask, or you might ask, so how long should I attend psychotherapy? Is it forever? Or is it a few sessions, then it will, it will be done? So I would say that it depends. Okay, so for psychotherapy, right, we will have short term, you can also have long term. So what is the difference between short-term psychotherapy and long-term psychotherapy? Actually, for short-term psychotherapy, right, or short-term counseling sessions, mainly if you are dealing with some immediate issues. So for example, if you have relationship problems with your partners, with your family members, so this will be quite easily to we will say quite easy to get rid of it. Okay, so it will be short term. Or for stress management, anger management, or everyday challenges, all this will go under short term psychotherapy. As for long term psychotherapy mainly is for those who need to deal with long standing and complex issues. For example, for those who are victims, okay, from physical or mental abuse, okay, or those who are experiencing or experienced serious trauma, you know. So all this we need quite a long time to help them to overcome it, to get rid of it. Psychotherapy also can be conducted in different manner. Okay, so the most common one will be individual, okay, which means it's one-to-one, where the clients and the therapists, they will work together in one-to-one manner to discover their problems, to find out the solutions. Or psychotherapy, it can be also in groups, okay, where psychologists or the professionals, they will groups, okay, those who have facing similar problems, okay, into a small groups, okay, so that they can share to each others. The good things, okay, for us to have a group therapy is that this allow the member, in the groups, right? They might offer or receive support from each others, because whenever sometimes when we are having the same issues, for example, we might having addictions, okay, we have this problem, these issues, so we attend a group therapy, and inside the group therapies, all the members also facing the same problems. But sometimes what I experience may not be what you are experiencing, or you might not experience before. So we can share and we can support each others. Okay. And beside individuals, beside groups, we might also have a couple counseling, couple psychotherapy, couple therapy. Okay. So for couple therapy, mainly we will work with couple who wish to improve their relationships. Okay. Last but not least will be family therapies. Okay. So where the center of this therapy, right, is to improve the dynamic within the family. Okay. And it might in family therapy, we might include multiple individuals within the family. So we might include fathers, mothers, okay, or auntie, uncles, our grandpas, siblings, okay, for those who involving in the issues. So who will be benefit? Who can be benefit from this therapy, and how psychotherapy help us? Okay, so we can see psychotherapy actually help a range of people. Okay, for those who has overwhelming feeling of sadness, who feel helplessness, who feel anxious, who have difficulties in facing their everyday challenge, stress, okay, or who have addict to alcohol, to drugs, or even if you have a small problem as you have relationship arguments with your families, with your uh, couples, with your partners, okay, all this we can seek help through the therapy. So for the therapy, right, psychotherapy can help their clients, okay, to improve in their communications problems. For example, relationship problems. Okay, why? Sometimes we will have relationship problems with our partners or even with our family members. Sometimes might be a small misunderstanding, might be communications problems. Okay, so through psychotherapy, through family therapy, we might improve how individuals in your families might able to communicate well. Okay, and psychotherapy also can give or helps people, okay, to have a healthier thinking patterns. Okay, improve their self-esteem, improve their self-confidence, and also have greater awareness about their negative thoughts. Okay, so negative thoughts, for example, they will say that I'm stupid, okay, I'm not good enough, okay, compared to others, I'm not perfect enough. All these are negative thoughts, and all these negative thoughts will indirectly reduce our self-esteem, okay, influence our self-esteem. Psychotherapy also will give the client some great insights about their life, okay, their goals, their aspirations, and also give them some ability provide them some ability or improve their ability to make healthier choices. So for example, when you're facing stress, okay, instead of you having binge eating, okay, what can you do? What is the alternative? How are you going to reduce stress? Maybe you can say that you can go for exercise, you can chit chat with your friends, okay, or you might find some things that you are interested, okay, drawings, playing music, singing, all these also can help you in reducing your stress. So improve your abilities, okay, to make a healthier choice, have a better coping strategies to manage your distress, and also it also will help you in uh, enhance or stronger your family bonds. Okay, so these are the benefits, okay, for us to attend or to go for psychotherapy. Besides that, psychotherapy also helps, okay, also very helpful for those who are experiencing their mental health conditions such as addictions, such as anxiety, easily get anxious, Uh, every day when you wake up, you will start to have different thoughts about your daily life. A little bit, you are getting anxious, depressed, feeling very down every time. Eating disorder, unable to control, binge eating, obsessive compulsive disorder, phobia, scared about some things, post-traumatic stress disorder, and last but not least will be substance abuse disorder. So these are the brief introductions to you about what is psychotherapy and how psychotherapy take place and who can benefit from the psychotherapy. Now I would like to pass back the time to Mr. Koh.
Okay, okay. Thank you, Grace, for your sharing on what is psychotherapy is. And of course, I hope that the audience also can get the idea of what the introduction in what is psychotherapy, and hopefully that you can, especially those unsure about that, what is actually psychotherapy and what is the concerns and the issue about. All right, so now perhaps that we could go into discussing some of the common myth that Malaysians always have been, to suggested to go for therapy or even
Mm,
contemplating about attending therapy for their mental health condition. All right,
mm,
so for the audience, if you have any questions or common myth you have heard yourself, all right, so about psychotherapy, you can also share with us under the FB Live or YouTube chat box, and I will go through them as well, and then we can raise some questions to any both of us. We will be more than grateful to answer as much as possible. All right, we given the
yeah.
time. Yeah. Okay. So we will be talking about one of the common myth here that we always heard about. With the statement, you see, like I'm not crazy. Okay, only crazy people will see a therapist. So, what is your thought on this? I mean, this is quite common, right?
Yeah, I think this is pretty common. I mean, whenever we ask, I mean, for me, like if my friends are facing some stress problems, or facing some emotions problem, of course, I will encourage them to visit counselors, as because I'm the professional in this area, in this field. However, the response from them will be, I'm not crazy, why you want to introduce me, or why you want to ask me to see a counselor? So I think this is pretty common. But I would say that actually for counselor, right, the
Yeah.
clients that they face, right, normally they are struggle with many problems that as we normal people struggling. For example, they might have relationship problems, like what I mentioned just now. They might have relationship problems with their partners. They don't know how to communicate. They don't know how to discuss with their partners. They might have self doubts, don't know whether they are good enough or not, whether they are suitable with these careers or not, whether they're able to reach course they need to enroll, something like this. They might have confidence problems, lack of confidence, lack of self-confidence, self-esteem, work-life stress. All these are the problems that we are facing every day, right? So
Yeah.
actually, it's not true. That's why in counseling or in therapy, right, we will call our the person as clients, but not patients, because they are
Mm.
not patients, they are not someone sick, but they just someone who are uh, not really sure which way or how to overcome their daily problems. Yeah.
Yeah, I think I could add on is that for this for the clients, right, they can actually seek an alternative opinion and also advice. All right, so
Yes.
mostly we will say that because I'm not sure whether this is we say as actually Asian or Malaysian itself. I wouldn't want to how to say it, like US or even
Mm,
UK, when the culture is much more open, and
mm,
also they are more to be able to express themselves, because maybe
mm,
due to the Asian culture, and then it's a kind of taboo, if because at the first perceptions that already people think, okay, if I'm going to approach a counselor or psychologist or even a psychiatrist as a first place, and then there is a stigma, all right,
yes,
so
correct.
even to your friends and family member, I mean, people actually kept quiet about their, how to say, about their concerns, about their issues in their life, right? So
Correct.
actually here we want to share with the audience here is that actually psychotherapy is a way to, to approach, of course, those are professionals, all right, so you will be thinking, okay, I can talk to my friends or I can talk to the family members, right? But sometimes certain things that you face in your life or your concerns or issue, if you think that there is a clash of interest, you see, or you may think that they may not be able to actually give you a second thought or opinion, all right, because you are staying close or you are friends and they may be stereotyping or bias,
Mm,
or the thing that they say might be, like how to say, to try to follow with the tempo, like, okay, they just maybe just don't think so much, all right, so maybe their advice is much more surface, all right. So of course, if you think the approach to see a psychologist or even with a psychiatrist or even a counselor, all right, so they can give you a very, how to say, could I say, very independent kind of how to say, non-biased kind of how to say, advice and along the
advice.
way, yeah. So I think they will also see in the situation what kind of therapy that they can actually how to say, help you on, right? I mean,
Yes,
this
correct.
will be, yeah. So I think we have to look into a bigger picture. If you personally you have any concerns, of course, the best, you talk to your friends or family member if you still have this stigma to approach a professional, or if that is a costly. But of course, we can also approach some, like I think NGOs, like even befrienders, right? They may not
Yes.
be the professional, but I think they have some training or some exposure. Like listening ears, of course sometimes people have some common, how to say, because like just now Grace have shared that about short term and long term, okay,
Mm,
all right, so a lot of things that you face is everything is accumulative. Of course, some things in life that you face could be, how to say, a sudden, like
mm.
someone dear to you like pass away, and then
That's right.
yeah, then you have to deal with grief, bereavement, the processes.
Mm,
Sometimes different people have different kind of level of acceptance and going through the processes, you see.
mm,
So yeah, so some became concern or issue, all right, in their life, that it affect your own self, okay, and someone surrounding in your environment, then I think perhaps you would need to approach those who are in the profession. You need to do something about that already. So first of all, you must be able to open up and how to say, willingly to help yourself to journey through the processes, yeah. So you don't, I mean, for the audience, or even if you have family members or friends, anyone that you meet, yeah, so you try to encourage that, yeah, they can approach, yeah. So this is one of the myths that we try to break the stigma of the
mm,
belief that you must be crazy, okay. Yeah, so yeah, it is a short kind of life situation, mental health kind of things, right? Yeah. Okay, so I will go to talk about the next myth that would be quite interesting. Okay, people will think that all therapists are the same. Okay, if you've seen one therapist, then you have seen them already. You will be just like giving that kind of judgment. Okay, okay, this kind of therapy is just the same as everyone. Like, no, there's no much different. So, what do you think about this on this
Yeah.
myth for Grace?
Actually, this is not really true, as we know that in therapy, right, we will have a lot of therapy techniques, right? Like, people might use CBT, Pearson, I mean the but REBT, different techniques. So,
Yeah,
sometimes, yes, maybe you go for the one therapist, you might think that it's not really suitable for you. It might take you quite a lot of times to try and error to see which therapy is really suits you. So it's not really saying that, oh, you go for one therapy which is not really suits you, then every one of them is like this. So I think this is not really true. So therapy will be quite effective, okay, when you're working with therapists. I would say that how to how to say that the therapy is effective is how you feel while you working with the therapist. Are you feel comfort? Are you feel safe? Are you able to open up yourself to talk about it? Yeah. So not all the therapists are the same. It depends on the techniques. That maybe it's how they approach you, the way that they mentions to you, they advise you. So yeah, it's different.
yeah. Grace, perhaps you want to share with the audience is that,
Mm.
all right, if let's say I'm having a concerns or a issue, all right,
Mm-hmm.
so I'm going to seek for support from a therapist, all right.
Okay.
So how actually does that applies for them? Because I mean, is there any channel or platform that they know? Because we talk about different type of therapy, correct? And
Correct.
also the profile. So will they be able to know the therapies prior, like their profile, then what they have done is that kind of, because you see, like we go to a clinic and then we can see like the doctors, their title, their positions, like, like, oh, they specialize in this, or this. So we can share a bit on that so that for the audience they can know, oh, okay, it's as such. So could you like share with this?
Okay, actually, for therapy, right, or for counseling, right, at the very beginning sessions before the therapy or the counselor deal with the clients, right, most of them they will tell they will inform the clients about what are they going to do. So as for CBT, right, they will say that, oh, they are more keen to CBTs. Okay, they will use a lot of worksheets. They will use a lot of these what kind of techniques they will be using, or uh, or before you going to visit a therapist or a counselor. I think nowadays, social media or
Yeah.
technology is quite improved, right? We can just go online and search, then there will be a lot of details popping out. Okay.
Mm.
But I think in Malaysia, right, a lot of the therapy they will be using CBT. Okay, because CBT is very common techniques that will be used in a therapist or in a and it's quite effective for most of the problems. Yeah, I would say.
Yeah. Okay. Just to also share with you all is that, as what Grace have shared here is that, of course there are different type of therapy, and of course working with as the therapy itself, and also how it really helps you to face your concerns or issue that in your life. All right. But first of all, you have this how to say, this connection with your therapist. Okay, so of course, at first you are a stranger, you don't know your therapist and so forth, but this is like how you know your friends from first. It's like acquaintance, you don't know, they are kind of like stranger along the way, and you have that many thoughts running your mind. Okay, whether I share my deepest secret or deepest concern to the therapist. whether this is confidential or whether to share with my family members and so forth. But I want to let you all know is that beside that, the therapists, they uphold their professionalism and their code of ethics, and whatever they have counseled, with you all or working through with your issue and concerns, definitely they will not be disclosing unless it's related to a life threatening to the client. All right. So if anything, they have to affecting the life, of course. Because sometimes there are many different situations, right? So of course they have to refer to the family member or even to the like for example like police and so forth, because we can say that we see cases like those who are contemplating for suicidal thinking, like some people contemplating they want to suicide due to their
Yeah.
and then they may say a lot of things or actions that can contributed, but of course they have to evaluate a lot of consideration. But I also want to share is that when a client or a person that also going to work with a therapist, sometimes also not about they are also only working on the different type of therapy or techniques of therapy, all right. But sometimes they also need to seek, depending on your situation or your concerns that they want to work with. Sometimes they will get other support from other mental health people to support also. Yeah, because it's quite wide, as we say. The concern is also not about being crazy or like there are many different situations. All right, some is coaching, some is mentoring on some of the things that you want to achieve. So even you want to build up your how to say confidence, all right, or you have this aim to work success in your academic, let's say, or even in your workplace, let's say some. So you may think, wow, even like this, you want to see a therapist. Yeah, but it depends on the individual in the life that what they want the support with. All right, so you see something different. It's not about being crazy or anything issue only. Something you want to build life in your life or goal, and then you need some different guidance depending. Some spiritual inclined, I would say. Some is very much towards their work or life or academic. Yeah, that can be even happens in that way. All right, so we can see. Okay, another thing is that I would just also to share is that therapies, right? When you see them, you only see at the certain time frame depending. Okay, people might thinking, well, how long will be I be in the therapy session? It depends on how the therapist did it, right? So
Yes,
like
correct.
maybe what are the usual common per hour? Is it like any idea that you can share
Actually, per sessions, right, is around 45 minutes to 1 hour per
all right
sessions.
per
So,
session?
for a course of psychotherapy, I think the minimum sessions will be 4 to 5 sessions. This is the
Hmm.
minimum, but everything is depending on the issues on what you want. Okay, so for example, if you are going to deal with a very complex issues, of course we need more sessions on that. But if, like for example, just now Mr. Kor saying that about setting goals, finding my what I want in my life, okay, then we might go for the minimum sessions, 4 to 5 sessions, and the counselor, the therapist, might guide you on how to set your own goals, how to set your own targets, how to build up your confidence. They will give you some practice, role play on it.
Hmm. So that will be coming to the next myth that will relates to this is that we will talk about psychotherapy is mostly just talk. Okay, for example, with the expression of I can just talk simply to my friend. Okay, so this is what is quite common. I just don't need to waste time. Every time I can just talk to my closest friend or my siblings. So what's your take on this in terms of this myth?
Yeah, I think just now, Mr. Cole already mentions. Okay, what's
Mm,
the difference? Okay, between talking to, yeah, of course, it's more we will feel more safer, or we will be more open when we talk to our friends, right? It's we are more because we know that our friends know us, know our backgrounds, know who we are. Okay, so we will feel more safer. But what is the difference compared to talking to a professional and with our friend? Actually, for psychotherapists, for professionals, right? They will not only listen to us, but they know they will use their knowledge, work with us, okay, help us to find out what is the real problems, the roots of the problems, okay, set our goals, find solutions on it, guide us on how to get rid of it. So this is the difference. So of course it's easier, we can, I mean, of course we still can share with our friends, but sometimes our friends don't have this knowledge, you know, don't have this knowledge to guide us. They will just okay, 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 never mind, it's okay, I will be with you. Yeah. Okay. I will give you my ears. I will listen to you. But they don't know how to guide us, you know, to get rid of it. Yeah.
Yeah, I think I also do agree with that. Another point I would share is that actually, in terms of because sometimes that if you talk to your friends or your siblings, they can be tend to be either very emotionally try to support you, or can be very logical at times. Okay, so
Yes.
yeah, so sometimes when we are down, some of them, those friends or family member, they are kind of like a very um illogical inclined, was saying that, okay, you don't think too much, okay, this problem will pass. All right, so they just tell you off, like, so sometimes you need the emotional support there, right? So sometimes I wouldn't say they can't do it, of course, but there might be a situation, or there may be some individuals or in family members. Sometimes you face this kind of situation. So yeah, so if this thing happens, of course, then of course that seeking counselors, or like therapists, psychologists, and so forth would be they can be much more better in terms of understanding your situation. All right, I wouldn't discounted that, oh, okay, your family members or friends are not doing the things that can help you, but we are talking about something serious. But if
Mm,
something like like daily, right? Like sometimes you talk and then you get over with it very fast already, then yeah, I think that should be fine. But we are talking about something that are more serious level here. All right. So we also go back to the myth is that it's not about talking about the concerns or the issue. It's about the actions that comes along the way as well, right?
mm,
Because we may heard cases of, like, like some people saying, all right, why I go to therapy, and then why it takes such a long time. Of course, just now Grace got shared that it's a short term or long term, if you all recall that. All right, so it depends on the issue and concerns that you want to address. Okay, so what actually in this therapy, right, psychotherapy, right, it's not that you just when you feel the issue, sometimes, because when you have the issue, it always affect you emotionally, and sometimes your thought process affects your action also, your emotion also, and your thinking affects your behavior to yourself and to the people surrounding. All right, so when the therapist, they trying to their best interest to help you or guide you through. All right, so it's not the matter of you think, okay, I'm just go there, I talk out, I express out, and then I get done with it, because the underlying issue is not is still there, and you are not working out by trying to have more actions and try to understand, try to process and accepting. Sometimes it's about also accepting the issue or the reality of the things, because sometimes we have a lot of a clashing like between the reality and what you want, but then it doesn't how to say arise, and then you kept harping on that particular issue, but you are trying to also move on certain situation. So it involves not only talk, but whatever in the process. That's why, as Grace said, that they have some um, surveys, some inventories for you to do,
mm,
some actions, depending on the different kind of uh, therapy that they are actually applying with. All right. Of
mm,
course, it also see that whether you feel comfortable, because the therapy also not going to be fixed with one therapy. If that doesn't work, all right, there will also be actually a try a different therapy that may suits you. All right. For example, I think we use a more layman term. If you're sick, all right, you go to the doctor, and then you tell the doctor, I feel a headache, have fever. Then the doctor asks you, do you feel pain here or there or any other symptoms, right? So the doctor prescribe you some medicine. Okay, they say that you take this like a medicine, maybe not sleepy. You say, I don't want sleepy one, all right? So, and then after that, you still have fever and still not recovering. Then you come back to the doctor again. So the doctor will try to understand if you have other symptoms, and then they check further, and they prescribe a different medicine, maybe a heavier this time. So same therapy also, it is not a fix, even though yes, they have certain techniques that the therapists also have their strength on certain techniques they will be using, but they also have other knowledge on other therapy as well. All right. So we just want to share that this is a myth that you're not going there, just talk and talk, and after that, there's no how to say outcome from there. All right. Okay. So another myth that we have is that psychotherapy can solve problem in 1 or 2 session. I think we also did say that it takes quite some time, right? And it also it's not immediately resolved. All right. So what is your thought about this, Grace?
I would say that every one of us, we want something instant, right? Especially nowadays, right? We want everything as fast as it can. So similarly, people was like, for example, just now, like we sick. When we sick, we go and see doctor. Okay, doctor prescribe us medications. We will also have the thought saying that, okay, we want to have some medications for us to take one time, then it will be recover. But sometimes it's not. In this case, it's very depends on the problems itself. Of course, if the problem is I will not say small, but something like easy to get rid of it. Of course, we can overcome it in 1 or 2 sessions. But when your problem is a big, especially like for example, you want to find goals for yourself. Okay, how to build up your confidence. Okay, it's time manner. We need sometimes, okay, to help in order for us to like train ourselves to change our thoughts. It's okay to change our emotions, to change our behavior. Yeah, so psychotherapy, of course, we it's not an instant thing. It's not like instant noodles, instant thing can a click, then it will be everything gone. Right?
Yeah.
Yeah.
Yeah. Also want to just add on is that also for this it's like not like 1 or 2 session. All right. Also that I would like to have a personal share to you all is that I have an extended family, and also my extended family. I have one aunt actually having a schizophrenia. Okay. Schizophrenia, I think this term is a bit bombastic. Maybe some of you
Mm,
know about that, but schizophrenia is someone who can have like the illusion of saying things, or also can have a listen, very illusion of listening some voices, like someone talks. All right. So this is a personal experience. That's why we are in the field of psychology. All right, with the interest in that. So my aunt actually also, we went to see psychologists or psychiatrists. Okay. All right. So of course, sometimes they are also hand to hand. All right. Sometimes, because some people don't really understand. I mean, to the audience, you might not be understand about what psychotherapy and how it was used beside than other type of treatments or therapy, and so
mm,
forth. And also there are also medical type of treatment, for any mental health issue. All right. But
mm,
for my aunt's situation is that because it's schizophrenia, usually they go for psychiatrists. Okay, so just to elaborate further or example, from the point that Grace earlier shared, that there's a 3 different types. Like one is like counselor, and then
mm,
psychologist, and also psychiatrist. All right. And yeah, we can see that those from the hospital, like they go to the hospital usually, that one, sometimes they say you can go to the department for see the psychiatrist.
mm,
Okay, and sometimes they can go to the department, they see psychologists. You
mm,
see, so I'm also taking this opportunity to let the audience knows that there is a different role and function, and their approaches to help on your concerns or issue. So psychiatrists, they actually also actually they prescribe medicine. Okay, so to the extent psychologists or clinical psychologists, I'm maybe perhaps I need Grace to share with me to what extent actually whether is clinical psychologists can uh, prescribe certain medicine or actually it's not a practice. But we understand those who actually can really prescribe medicine on top of counseling or psychotherapy, the psychiatrists can do that. Okay, so because we don't want you all to fall victim into, like let's say there's not those who are not really professional and they just want to uh, get the money out from you. So you must be also how to say be prudent and understanding the approach. So those who prescribe, definitely it's the best you go to hospital. Okay, and
Correct.
of course, yeah. So for my aunt, actually, sometimes she went for the sessions, and of course, at the same time, it's a long term. If you ask me, till now, my aunt haven't recovered from schizophrenia. But the most important thing is also not focus on looking for psychiatrists or psychologists or therapies. All right. Um, you as a family member, let's say if you have the same experience, all right, in your friends, have this. Actually, most important thing is that you shower your love and your concern and care for example, my aunt. All right, because usually we have this stigma. We always very scared. You see earlier, the first myth is about talking. I'm not
Okay.
crazy. Yeah, only crazy people see therapists. Sometimes is if that myth is talking about you yourself, lah, right? But you also talking about the surrounding family members or friends that are facing this situation. All right.
Mm,
So what you have is that okay, you don't have any issue, correct? So what you can actually support, all right. So sometimes if you think you cannot be how to say good advice, not professional, you think okay, I think better, because sometimes your friends or family member they rely on you and talking to you your issue,
mm,
and then you think one time at the time you say okay, I don't really helping much, even though you talk that okay, every time I listen to my friend or family member their issue or their problems, right? But they doesn't get through
mm.
over their issue. It's still there, and years or months you still keep hearing, and think maybe one day you feel frustrated also. Hey, why, right? So that's
They keep
why.
on hiding these thoughts. Yeah.
Correct, correct. So why? I mean, it is important that you also advise your friends or family member that they can seek the professional help. All right.
Mm,
So it's important for your audience that sometimes you know how to, hope that this myth, all right, can give you an eye opener also. All right. So how do you support others? Not only to yourself that when you have issue, because earlier we are talking about you need to seek who and so forth, right? But to your friends and family, immediate family members as well, how you can support them and how can you advise them. All right. So this is actually we are talking about a quite a dynamic approaches on solving your problem, and we know that it takes time until the person can overcome or resolve or achieve what they are looking at. Nah. All right. So this is the fourth myth that we are talking about. All right. So the next myth is that we talk about therapy is expensive. This one I let Grace share why is therapy is expensive. This myth, right? Yeah.
Uh, okay. First of all, I would say that expensive. The word expensive is very subjective. Okay,
Mm,
those how we define expensive, but why some people will say that. Of course, we know that for therapy per sessions is around the minimum will be around 60 to 120 or to 150. So some people would think that, oh, it's not worth, for me to pay 120 and go for the therapy for 60 minutes and I just talk, 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 talk. The therapy would just ask me some questions and I just talk it. It's not worth it. Okay, why I need to pay so much? Why not I just like what we just now mentioned? Why not I just talk to my friends? It's free of charge. But on the other hand, we need to think, we need to know that actually for all these professionals, okay, they spend years Okay, especially for psychiatrists, I think they need as their medical school. After that, they need to specialize on it. At least they need to spend 5 to 7 years, okay, for them to get these professionals to get this knowledge. So I think they worth it. They worth it for that kind of charges. Of course, when you go and see them, okay, when you visit them, they will give you some very professional guidance, correct enough. So I think this is not we was of course we sometimes we were still saying that therapy is very expensive, but on the other hand, you need to know it's worth it. You will get more than just talking to your friends, correct?
Mm.
Mm.
Yeah. So we understand that usually is the range of sorry is 60, is it, you say that the
Yeah, the
minimum.
minimum, yes.
All right. And these actually are only in private practice, or actually in the hospital, there are charges in this. I mean, is there any differences between like those who are having their own clinic, psychology clinic and so forth, that they are private practice, or those who are attached in like a hospital, what are the difference? Because perhaps we can enlighten our audience here, the difference and so forth. Yeah, or any advice that go to the private psychologist or go under the hospital, government hospital and so forth, like any distinction and or anything that you can share with the audience.
Okay. Uh, Actually, if you want to, of course, if you want to seek a psychologist, I would say that uh, you can go for a hospital, but in Malaysia, right, not much hospital they have this psychologist service. I would say that that's why it's very depends. But if you go for hospital, the one of the benefit you seek helps in the hospital will be they might have a very range of referrals, which means that if this psychotherapist or this psychologist they're unable to help, they're able to refer you to psychiatrists, to they will lift it up, yes. So I would say but for the charging wise, right, I would say there's not much difference. Okay, not much difference. But of course, if you couldn't compare NGOs and private
Yeah.
uh services, okay, of course NGO they will be much more cheaper. Okay, some of the NGO they comes to 30 per sessions, and some of the NGO they provide a free counseling sessions to those who need it. Yeah.
Yeah. Okay. Yeah. Thanks, Grace. And I think we are about near to the time, so perhaps we could have any audience that if you have any questions you would like to ask anyone, both of us, we would be more than grateful to share with you, and you can just leave your comment here in the chat box, and we will try to answer your question, maybe one two questions um, before we have the wrap up sessions. If you have, don't be shy, or feel free to ask us questions. All right. Okay. So I haven't seen any chat or any question posed. So I believe that we have covered the basic, of the psychotherapy, and different type of roles that play by psychologists, psychiatrists, or even counselor, so that you can see the difference and different type of therapy that apply in Malaysia. Of course, maybe there are some quite unique one, but we will maybe future we will cover a different session. We can talk more into different types of therapy, more in depth, and we may have a different type of topics. Okay, so if there is no questions, I can say that thank you for your participation so far tonight, and we are glad that we are able to share to you all on the crucial topic, especially this is very essential. And of course, during the MCO, I believe that quite a lot of people or individuals staying at home, quite some time, and mobility wise, you couldn't, go out a lot. Of course, you can say that you are bridging through staying at home, meeting, seeing your family, staying together, That's another way of getting to know your family well, in terms of maybe we could see bonding. But of course, once last time I have studied, and our professor or lecturer say that human is like very like social animal, right? So they kind of like they need to go out and move around.
Social.
Yeah, unless you are introvert, maybe you are kind of like okay with staying at home. But some people are extrovert. They need to go out, not about being able to talk but socialize, but they need to go around places. So some people who are staying quite long, inside the house, or the movement is quite restricted, they couldn't do much things, then that comes a lot of mental health issue and concerns, or financially as also affecting them, you see. And yeah, it is also not about being staying and the mobility, so it's about other underlying pressure, economics, all that kind of things that affect the pandemic. So of course now we are in the recovery, but then we give the insight that at any point of time, because it doesn't only happens during pandemic, but pandemic, maybe the COVID-19 pandemic can worsen the certain situation in terms of the mental health, all right, of the person, the individual. Okay, so I would say actually that I hope that we will have the audience here totally get an interest, so that if we can have more topics to cover in future. All right. So if you are actually interested learning on psychology, or want to know about what is psychology itself, we actually have existing program here offered in SEGi College Penang. We are offering actually American degree program. It's a tri psychology. Of course, you can also minor in communication or global business. All right, so you can have the understanding of business, also in communication. All right, so yeah, and also we are having a coming new program starting soon in our college, which is a diploma in psychology. All right, so we have a diploma in psychology which is from SEGi, and then we have an American degree program, try psychology here, offered 4+0, which you can study 4 years here locally. And what you need to do is that 5 credits in your SPM. Of course, there are certain requirements, and for diploma, we have 3 credits, of course, with certain requirements. And that requirements, I will leave it for pick your interest. And if you want to know more, you can actually contact us. So we have our contact here, our WhatsApp, we have our email. You can just talk to any one of our academic counselors, our sales counselors. All right, they are not the psychology counselor, so it's just sales staff colleagues here. And of course, they will be actually entertaining your inquiries. So we will be more than happy to actually talk to you in person if you want to know about the program. So because we are from the American degree program faculty, so you can feel free to come to the college and talk to us and know more about the program that we are offering here. And with that, I would like to say thank you and have a pleasant evening, and hope to see you all again. Okay, so good night, everyone.
Bye. Good night. Bye.
Bye bye.